My name is Xavia Fuller. I am actually a nurse at Houston Methodist Hospital. Been here almost 15 years. I have a husband, been married almost 5 years, and we have a dog, and we love to travel. That's our favorite things, and spend some time in the country. We have a house in the country, and we love to look at the stars and the moon and love the sunsets. That's our great afternoon. We were actually in a infertility process, so we're trying to do IVF. And so before you can start IVF, you have to go see your OB. She did a breast exam. I did a breast exam. It was nothing there. And then during the process, I was doing injections for IVF. And I was like, oh, it's been a month. I probably should do a breast exam. Did my breast exam and found a lump. And I was thinking maybe it was just the hormones from the IVF. So I was like, let's just go get it checked out before we move on from there. And so we got an ultrasound, and during the ultrasound, the woman took so long, and I was like, she must see something. Then the doctor came in, and we went from there. I started crying. We did biopsy, and 2 days later, the biopsy came back positive for breast cancer. So the process was long. I did 11 rounds of chemo. I ended up getting a lumpectomy, and before we scheduled the lumpectomy, Dr. Lim works with Dr. Spiegel, and that's who she recommended. So our process was, I met with Dr. Spiegel, we worked out a plan, we did the lumpectomy, and she wanted to do her surgery after I do radiation. So I did radiation and oral chemo, and 6 months after my end of radiation, I came back, met with Dr. Spiegel, met with Dr. Lim. We did a double mastectomy, and we did direct implants. Now I am about 4 or 5 months out. I'm feeling great. I'm back at work. It is wonderful. I feel normal. I'm down a little bit, so I'll take that. But other than that, they look great. Nobody ever knows that I had surgery or they know anything about my journey unless I tell them. So that's the nice part. It's very comforting. Dr. Spiegel has a great team with her. So luckily I got to express myself and cry before she came in with her team. And then she came in and she still comforted me. She made me feel like I was doing the right thing. And she gave me her recommendations, and I told her my wants. And so we worked it out where we both got what we wanted. And so that made me happy at the end of the day. This process, and I know it may sound crazy, but having breast cancer wasn't bad. I know it really wasn't bad for me. I got lucky that I found out I had breast cancer. I was a week to putting in my embryos when I found out I had breast cancer. And I didn't have to slow down. I still had everything. My whole team was there. Everything was great. It went so fast, and before you know it, I was done, and it worked out. And hey, so it really wasn't bad for me. I mean, I know it's a long journey, but you got to be positive. It's okay. It's nice when you have good people around you. I think really all I can say is just thank you. Thank you for getting everything started, letting us go through this journey, the team being there all the time. Sometimes it's really hard to take care of other healthcare professionals, and I know that. And so I tried, but still it's hard to not be a healthcare professional. And so they indulged me, and I really appreciate them, me doing my own research and them helping me figure out the best way and doing the right thing. I really appreciate that. And also giving me the blessing to continue my family. So that was great.